Hello, my name is Ryan Butler, and I'm a nurse practitioner student at Maryville University, and today I'm going to be conducting my head-to-toe assessment on my patient and volunteer, who I will refer to in this video as B. B is a 26-year-old female who, prior to entering the room, I had her empty her bladder, change into this gown. I did a full set of vital signs. I assessed her height and weight, and I did a distance vision test using a Snellen eye chart, testing cranial nerve number 2. I also washed my hands, and I'm going to don on these gloves. I'm going to start with the inspection of B's head. I'm noting that her skin is clean and intact without any erythema or swelling. I noticed that her head, her skull is normal cephalic. I'm going to palpate her skull as well, noting that it's normal cephalic. Her hair is thick and brown. There's no signs of alopecia. Next, I am going to palpate B's facial bones, so her mandible, zygomatic, and her frontal bones. I note that there is no tenderness or swelling or any gross deformities. I'm going to also palpate B's sinuses, so her frontal, ethmoid, and maxillary sinuses are again without any tenderness or swelling. Next, I'm going to have B follow some simple commands. I'm testing cranial nerves 5 trigeminal, 7 facial, and 12 hypoglossal. So B, if you could, I want you to squeeze your eyes, okay? Wrinkle your forehead, good. Puff your cheeks, okay? Clench your jaw, stick out your tongue, and smile for me. Very good. Next, I'm going to palpate B's temporomandibular joint. So if you could open and close your jaw for me and move it side to side. Very good. I'm feeling and listening for any pops or clicks that might be present, which B does not have any. Next, I'm going to move on to B's eyes. I'm noting that her eyes are symmetrical on both sides. Her eyebrows sit on the outer portion of her eyes as well. I note that her eyelids are not turned inward or outward, which would be ectropion or entropion. I notice that her eyelashes curve out away from the globe as well. I'm going to have B look straight ahead and cover up one eye, if you would, okay, and uncover that and cover up the other eye. Very good. As I do this, I'm looking for any strabismus, which is any abnormal movement of the eye. I'm also looking for any nystagmatism, which is any involuntary rapid movement of the eye. I look and I see that there's no ptosis or drooping of the eye as well. I'm going to look at B's ocular movements. So B, if you could follow my finger, by doing so, okay, I'm testing cranial nerves 3, 4, and 6, which is oculomotor, abducens, and trochlear. Next, I'm going to have B hold this Rosenbaum card at arm's length away from her. And can you read the 4th line up from the bottom, please?
4, 2, 8, 3, 6, 5.
Very good. I'm also going to assess B's pupillary response as well. So if you could just look straight ahead. I'm looking and noting that there is equal coronary light reflex. I'm also going to note pupillary response. So there is direct and consensual, direct and consensual. So her pupils are equal, round, and reactive to light, which is normal. Next, I'm going to assess B's red reflex using my ophthalmoscope. So if you could just look straight ahead for me. Okay, that is intact. And we'll check the left eye. And that one is intact as well. Next, I'm going to test B's sensation on her face. So I have a cotton ball here, and so B, I'm going to rub this on your face, and tell me if you can feel it, okay? Just say yes or no. Close your eyes. Good.
Yes, 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 yes.
Okay, and is that hard or soft or dull?
Soft.
Very good. Next, I'm going to move on to B's ears. Whenever I move on to her ears, I'm going to be doing some sound testing, which is cranial nerve 8, which is the acoustic. First, I'm going to start with inspection of her ears. Again, her ears are symmetrical on both sides. There's no swelling or edema noted, no redness or drainage, no exudates coming out of her ears. I'm going to palpate her auricles, which are mobile and but yet firm. No marked tenderness. I'm going to come around here on behind B, and I want you to cover up one ear for me. And I want you to repeat the word that I say.
Basketball.
All right, cover up the other ear. Good. And repeat the word that I say.
Baseball.
Very good. So her whisper test is intact. I'm going to move on to using my tuning fork, and I'm going to assess B's hearing. I'm going to be doing the Weber test, so I'm going to hit the tuning fork, and you should be able to hear vibrations in both ears, can you?
Yes.
By placing it on the skull, so it's intact. Next, I'm going to do the Ren test, which I will hit the tuning fork, place it on her mastoid bone. Once that sound is gone, I'll place it by her auricle, and she should still be able to hear the vibrations of the tuning fork by her ear longer than the bone conduction. So here we go. Tell me when you can no longer hear it.
Okay.
And can you still hear it?
Yep.
Very good, and we'll do it for the other side as well.
Okay.
And can you still hear it?
Yes.
Very good. So air conduction is longer than bone conduction, so that's normal. Next, I'm going to use my otoscope, and I'm going to inspect B's ears. As I go into her ears, I'm looking at her. I'm going to pull the pinna up and back. I'm going to look in her ear canal here and look for any erythema or drainage or swelling that might be present. Her tympanic membrane is pearly gray and it's intact. And I'll do the same thing for the other ear, which is pearly gray and intact as well. There's no erythema, no bulging, no swelling or tenderness noted on that as well. Excuse me. Next, I'm going to move on to B's nose. I noticed that her nose sits symmetrical on her face. The skin is intact and it's clean. There's no deviation. I'm feeling the nose as well. It's nice and firm. The tip of her nose is mobile. I'm going to grab my light here, and I'm going to have you tilt your head back so we can look up in your nose. I'm looking into B's nose, and I note that her inferior and middle turbinates are intact. Her mucosa is pink and moist. Her septum is pink and moist without any perforations or bleeding. Everything is nice and clean. I'm going to have you cover up one side of your nostril and breathe in and out of it for me. Good. And do the same thing for the other side. Very good. So her breathing is intact. Again, there's no nasal flaring, which would indicate possible respiratory distress. Next, I'm going to move on to B's mouth. And I look at her lips. I notice that they're nice and symmetrical without any cracking or bleeding. And go ahead and open up your mouth for me. We're looking inside her mouth. Her hard and soft palate is dome-shaped and pink and moist. Her tongue is well papillated. Her anterior and posterior pillars are intact and clean. Her uvula is midline. Her teeth are pearly gray without any dental caries or gingivitis. Her gums are intact against her teeth, nice and even. The bottom of her mouth, or the floor of her mouth, is pink and moist and intact without any exudates as well. I'm looking at her oral pharynx. It's pink and moist without any exudates or drainage as well. I'm going to have B say ah, and I'm going to test her gag reflex, which is cranial nerve 10, which is the vagus, and 9, which is the glossopharyngeo. So say ah. Good. And test the gag. Gag reflex is there. And again, by saying ah, the uvula is midline and intact. So everything is good there. Next, I am going to move on to B's neck. And I'm going to again start with inspection. I look, I see that her neck is nice and midline, it's symmetrical. I'm feeling her trachea, and I'm looking at her trachea, noting that her trachea is midline. It doesn't deviate to one side. Her trachea is nice and firm. It doesn't deviate as well. I'm looking for any jugular venous distension. I'm also looking, which I don't see, and I'm looking for any thyroid swelling, which I don't see. I am going to have B take this cup of water, and we're going to assess or palpate B's thyroid. So whenever you're ready, go ahead and take a sip of water for me. Very good. The thyroid moves up and down freely without any tenderness noted. I'm also going to palpate the carotid arteries on both sides, one at a time. And I note that her carotid arteries are equal and strong and intact. Next, I'm going to auscultate her arteries. So B, if you could take a small breath in and hold it. We'll auscultate the carotid artery on both sides, noting for any bruits that might be present when she does not have. And we're going to auscultate the thyroid to see if we hear any bruits which she does not have as well. Next, I'm going to have B. Can you tilt your head forward? Good. And tilt it back. Good. And then move it side to side. Good. And then take your ear and try to touch it to one side of your shoulder, and then the same for the other side. Very good. So her active range of motion is intact. Next, I'm going to do passive range of motion. So I'm going to have B push against my hand. Very good. And up against it. Very good. To the side and to the other side. Very good. So her passive range of motion is there as well. Push it to the side, back and forward. Good. So all of that is intact. Next, we're going to, I'm going to use the pads of my fingers, and I'm going to palpate the lymph nodes. So occipital, post-auricular, pre-auricular, tonsillar, submandibular, submental, superficial cervical, deep cervical, or excuse me, posterior cervical, deep cervical, supraclavicular, inferior clavicular, and if you can hold your arms up, the axillary. So again, no tenderness or swelling noted on palpation of her lymph nodes. Next, I'm going to look at her shoulders, and I note that her shoulders are symmetrical as well. And I'm going to be testing cranial nerve number 11, which is the spinal accessory nerve. So B, if you could push up against my hands, very good, and then do a quick shoulder shrug for me, very good. So that's all nice and intact. Next, I'm going to move on to B's upper extremities. I'm going to have you hold your arms out for me, and can you bring your fingers in toward your body and then bring them out? That's abduction and adduction. Those are nice and even. Her skin on her arms are pink and moist. It's nice and warm to touch. Her musculature is intact. Relax your hands for me. Her joints move freely in her hands and her fingers. I'm palpating her hands and fingers for any tenderness or inflammation that might be present. Her arms move freely without any tenderness as well. Her shoulders feel without any nodules or tenderness as well. Her shoulders move freely. Does any of that hurt? Very good. I'm looking at her fingers and noting that there's no cyanosis, there's no clubbing. Her capillary refill is less than 3 seconds, which is normal as well. And again, musculature in her arms is equal and symmetrical on both sides. Next, I'm moving on to B's anterior chest. I'm noting that her respirations are equal and rhythmic. They're equal chest rise and fall. Her skin is clean and intact without any nodules or swelling that might be present. There's none there. I'm looking to see if I see any thrills or heaves noted on her chest, which I do not. Next, I'm going to percuss along her anterior chest wall. If you could hold your arms up for me, we'll go ahead and check the lateral aspect of the wall as well. We'll get that out of the way first. I'm hearing resonance through all of the lung fields. You can relax your arms. I'm gonna check for tactile firmitis. So I'm gonna place my hands on your chest and just say 99 for me, okay?
99, 99, 99.
Very good. So vibrations are equal and intact throughout all of her lung fields. Next, I am going to auscultate through her lung fields. So if you could, let's start here at the trachea and breathe in and out. I'm listening for bronchial sounds, which are present in through the lung fields. I should be hearing vesicular sounds. As I get closer to the bronchial trees, I should hear bronchiovesicular sounds, which I do. I don't hear any wheezes or crackles or rhonchi that might be present, or any friction rubs that might be present. If you could hold your arms up, we'll auscultate the lateral aspects of your chest. So again, everything is nice and clear. No crackles or wheezes noted. All right, so inspiration is all clean, and expiration is clean as well. Next, I am going to auscultate the heart tones in B's heart. So we'll start here with the aortic, the pulmonic, Erb's point, tricuspid, and the mitral. Very good. All right, B, if you could, I want you to go ahead and lay on your back here for me. We're going to palpate her chest. And again, I'm palpating her chest for any thrills or heaves that might be present, which she does not have. Okay, if you could go ahead and lay on your left side for me, B, we're going to palpate the apical pulse, which is nice and intact there as well. So B, if you could go ahead and sit up for me. Very good. Next, I'm going to have B go ahead and turn around for me. Let's take a look at your back. And as we look at B's back, we're going to go ahead and note her cervical spine and her lumbar spine. Everything is nice and intact. There's no S shape. I'm feeling her spine all the way down. It's nice and straight. There's no curvature to it like a scoliosis. I don't note any kyphosis or lordosis. Her lumbar spine has a slight concave contour to it, which is normal. Again, her respirations are intact and equal and symmetrical. I don't notice any retractions. Her skin is clean and intact without any nodules as well. I'm looking again at her shoulders here, noting that they're nice and symmetrical on both sides. I'm going to palpate through all of her lung fields again, or percuss, excuse me. And we should be hearing resonance until we get to dullness. Very good. All right, I'm going to palpate and percuss her costovertebral angles. Is there any tenderness or pain there?
Nope.
No? Very good. Next, I'm going to have you, if you could kind of lean forward a little bit and cross your arms. Very good. So that opens up the scapular area and allows us to get a good look at the back. I'm going to grab my pen here, and I'm going to have B take in a big deep breath, if you would, and hold it. We're going to check diaphragmatic excursion. Okay, and we'll mark that. All right, and do it on the other side real quick. Mark that point as well. Okay, breathe normal real quick. Okay, and whenever you're ready, go ahead and let all of the air out. Okay, and we'll mark that point, and we'll come up on the other side. Mark that point. Okay, breathe normal. Normal diaphragmatic excursion is anywhere between 3 and 5 centimeters. And B is right at about 4 centimeters, so that's within normal limits. B, I'm going to have you say 99 again.
99, 99, 99, 99,
Okay, very good. And I'll place my hands on your back here and take a big deep breath in and blow it out. Very good. So equal chest rise and fall there as well. Next, I'm going to auscultate through her lung fields on the back side. So again, deep breath in and blow it out. Again, I don't hear any crackles or wheezes or bronchi or anything of that nature. Her lungs are clean and clear and intact. Okay. So vesicular sounds are all through the lung fields as well. B, I'm going to have you do another experiment for me. I want you to say basketball for me.
basketball, basketball,
Okay. So what I'm doing there is I'm checking for bronchophony and agophony. With bronchophony, words are clearly spoken, are clearly understood on auscultation whenever they're spoken. And egophony, those same words would be heard clearly, but with a nasal quality. Next, I'm going to have you whisper caramel for me, if you would. Okay. So I'm testing for whispered pectoriliquy, which would be easily heard whispered words on auscultation, which B does not have as well. So again, her musculature on her back is nice and symmetrical on both sides. So I'll go ahead and have you turn around here again. And actually, if you want to, go ahead and kind of lean back here a little bit for me. And we're going to check for jugular venous distension. So we lay the patient at 45-degree angle, which B does not have any jugular venous distension. So we'll go ahead and lay her on back here. And we're going to take a look at B's abdomen real quick. So we'll kind of pull her down up here just a little bit. Pull her shorts down just a little bit. Okay, very good. Let me come around here on this other side. So I start again with inspection of B. I'm noting that her abdomen rises and falls as she breathes normally. I'm going to use tangential lighting and look for any bowel movements that might be present. I'm looking to see, because she does have a thin body, that's the contour of her body is thin and it's symmetrical on both sides. I do note that there is a slight aortic pulsation, which is normal in thin people. I don't see any abnormal bowel movements, which would indicate possible bowel obstruction. Next, I'm going to percuss along all of the quadrants, and I should be hearing tympani throughout, which I do. Next, I'm going to grab my ruler again, and we're going to percuss liver borders. Okay, we'll mark that point there. Alright, and then we'll come up from the base till we hear dullness. Okay. And normal liver border should be anywhere between 6 and 12 centimeters, which B's is right at about 10 centimeters, so she's within normal limits. So we've percussed the liver. Now we're going to percuss for splenic dullness. Okay. Next, we're going to move on to auscultation, which actually we should have done auscultation before we did percussion. So we should be listening for any clicks or gurgles in her abdomen, which would indicate that her bowels are moving properly, which there is. Next, we're going to auscultate her arteries. So we'll auscultate the aorta, and then the right renal artery, left renal artery, right iliac, left iliac, right femoral, and the left femoral. Okay, those are intact. We're going to go ahead and palpate the aorta pulse, which is intact as well. And again, we would go from inspection to auscultation on the stomach because any movements could cause bowel movements to be more spontaneous, and you would be able, you would hear those on auscultation if you were to palpate or percuss before. So we would actually auscultate first and then palpate and percuss. But for the purpose of this video, we'll just continue. We're going to go ahead and start with light palpation of B's abdomen and palpate all 4 quadrants. We do it light palpation to get the patient used to our fingers and check for any grimacing that might be present as well. Next, we're going to move on to deep palpation. So we're going to deep palpate the liver and the spleen, and then the left kidney and the right kidney. Okay, and then a B, if you could, I'll go ahead and have you sit on up for me. And as we sit up, I'm looking at her abdomen and noticing the musculature in her abdomen. Next, I'm going to move on to her lower extremities, and I'm looking at the musculature in her legs. It's nice and symmetrical. There's no edema noted. Her legs are shaved, but if she had hair on her legs, I would note that the hair is symmetrical, or if there was one leg that had more hair than the other, I might think about vascular issues as well. Excuse me. Her legs are, again, symmetrical, warm to touch. The skin is pink and moist. I'm going to feel for her arteries. I'm going to do brachial arteries, equal and strong. Radial arteries are equal and strong. Popliteal arteries are equal and strong. I'm going to come down here to the top of the foot for the dorsalis pedis on both legs, equal and strong. I'm going to feel the posterior tibial, which is right behind the ankle on both sides, and those are both equal and strong as well. Next, I'm going to check B's reflexes. So I'm going to have B, let me see your arm here real quick, and we'll do brachial, good, and then brachial on this arm. Okay, that's intact. We'll do the knees, good, good, and then we'll do the Achilles, good. And then this Achilles, it's intact as well. Next, I'm going to have B, we're going to test cranial nerve number 1, which is the olfactory nerve. So B, if you could close your eyes and smell this. What does this smell like to you?
Orange juice.
Okay, very good. And then we're going to test B's sensation as well. Go ahead and take a sip of that and tell me, does it taste sour, sweet?
Sweet.
Sweet, okay, very good. Next, I'm going to have B check and see if she feels anything sharp or dull. So if you could close your eyes, tell me, is this soft, dull, or sharp?
Soft.
Okay, and then tell me again, is this soft, dull, or sharp?
Dull.
Okay, and then is this soft, dull, or sharp?
Sharp.
Okay, very good. Keep your eyes closed for me, and I want you to tell me if you feel 1 point or 2 points.
2.
Okay, and do you feel 1 point or 2 points?
1.
Very good. All right, and then stand up for me real quick if you would, and I want you to, can you do a squat for me? Very good. So the musculature in her legs is equal and strong as well. Can you squeeze my fingers tight? Very good. Upper extremities are equal and strong as well. I want you to swing one leg out to the side. Very good. And then swing the other leg out to the other side. Very good. And then if you could bring one leg forward and back. Good. And one leg forward and back. Good. Balance on one foot. Balance on the other foot. Very good. Any pain or tenderness noted there?
Nope.
Okay, very good. And then if you would, I'm going to have you lay back and we're going to look at your knee reflex, or see how your knee bends. really quick. All right. So we're going to bring your knee up and back. Very good. And then up and down. Very good. Any tenderness noted there as well?
Nope.
Okay. And I believe that is it for this head to toe assessment. Thanks for watching.